Good evening, ladies and gentlemen. My topic, final topic of the day, talking something about new molecules in the management of diabetes. Already we have learned a lot regarding the old molecules and the mechanism and pathophysiology. And there are so many new molecules available to treat diabetes. That's why there are so many new medications as well. So we can classify the targets into conventional targets and recent targets and future targets. Conventional targets like all these medication like metformin, sulfonylurea and insulin. And recent targets, you have learned now that GLP-1 agonist and SGLT2 inhibitors and other drugs. And there are so many future targets. There are so many minor molecules in the management of diabetes. So as you all know, the management of diabetes, we all consider about cardiovascular disease because diabetes is a cardiovascular equivalent and most of the diabetic patients die because of cardiovascular disease. So that's why we need to think about any subatomic pathways or molecular levels to prevent death, morbidity and mortality in diabetic patients. One of the main things is glucocorticoid receptors. Glucocorticoid receptors has a distinct effect on insulin action, both endogenous or exogenous. In general, glucocorticoid increase the blood glucose level when required by the brain, but chronic stage activation of these receptors associated with metabolic dysfunction, including insulin resistance. So there are emerging treatment targets. One of the main drug is 11-beta hydroxysteroid dehydrogenase. So here we can see the action. Is there any drug to inhibit 11-beta hydroxy dehydrogenase? It improves the insulin sensitivity and increase the glucose tolerance, reduce gluconeogenesis and reduce fasting glycemia and reduce the HbA1c and finally postprandial hyperglycemia. Similar to that, there's a molecule glutamine fructose 6-phosphate amidinotransferase. As you all know, in glucose metabolism, there's a pathway called hexamine pathway. So is there any molecule inhibit the pathway? So that is called glutamine fructose 6-phosphate amidinotransferase, one of the important pathway. If any molecule there, any drug to inhibit this molecule, we can reduce the incidence of diabetes. There are so many new molecules like protein tyrosine phosphatase. There are so many subtypes. The important one is 1B. So similar mechanism, insulin receptor activation and because of the signal pathways in insulin formation. So this is one of the American thing called SLIM. Initiative in genomic medicine in America. There are so many genomes like SLC16A11. Some genes, main reason for the development of diabetes. So if you find the gene, genetic studies, so we can do some molecular modification and reduce the incidence of diabetes. So this is one of the main recent target, SLC16A11. If somebody's genomic area SLC16A11 plus, high risk of type 2 diabetes. So every day you can see in the journal articles there are so many molecules related to diabetes. One of the important one is CCN3 or NOV. That is mean nephroblastoma overexpressed gene. So if somebody is CCN3 or NOV high chance to develop type 2 diabetes. So if you check this level in any diabetic type 2 patient, we can see increased number of this level. So this is one of the novel therapeutic target, important target for the type 2 diabetes. So the important next one is FOX01. So what is FOX? Forehead transcription factor. So this is one of the newest molecular target in the mediator of insulin signaling in beta cells. Similar to FOX, there are some other molecules, FFA2 and FFA3. These are called free fatty acid 2 and 3. So if you compare and consider the normal islet cells and beta cells, we can see how this free fatty acid 2 and 3 correlate with insulin resistance. So these are one of the new molecules to treat type 2 diabetes. So you may have heard about EETs, epoxy eicosar trienoic acids. You can see the conversion here, how it has changed. And there's a mechanism called ACH inhibitor. Why this is important? For cardiac remodeling, hypertension, diabetes, fatty liver and kidney disease and atherosclerosis. So these molecules very important in all these pathology. So if we have any new drug to inhibit this ACH inhibitor, we can reduce the prevalence or development of all these metabolic complications. So there are so many things like PPAC1A and PPARC, you know, because one of the traditional drug like pioglitazone, main action is against the PPAR gamma molecule. There are so many new molecules they are trying to find out any new drugs. So one of the recent molecule people search is neprilysin. This molecule also mainly potent involvement in GLP-1 amide and GLP-1 102. So these molecules also one of the future targets for the management of diabetes. As discussed by Dr. Manilka earlier, there's a crosstalk in between diabetes and fatty liver and NASH and NAFLD. All these NASH and non-alcoholic fatty liver disease is very common in type 2 diabetic patient, and the morbidity and mortality remains significant in diabetic patient with non-alcoholic fatty liver disease. So how to control non-alcoholic fatty liver disease? The PPAR gamma molecule like pioglitazone we tried earlier. And there are so many new molecules targeting in the management of non-alcoholic fatty liver disease. So that is one way. Even GLP-1 agonist and other treatment also you can try for non-alcoholic fatty liver disease. So as a combined disease, diabetic patient, if somebody develop diabetes, they develop hypertension, heart disease, and non-alcoholic fatty liver disease. So we need to think diabetes as a metabolic disease, and we need to find molecules to treat diabetes as a metabolic disease. And there are so many articles about this stem cell therapy. And as Dr. Manilka mentioned, in pre-type 1 diabetes, like pre-type 2 diabetes, there are ways to diagnose type 1 diabetes like stem cell therapy. And there are so many new molecules in the pipeline. These are one of the 3 important molecules and still in the research process. So in next sessions, we may come across so many new molecules in the management of type 2 and type 1 diabetes. Thank you, the organizers, for giving me this opportunity to talk something about new molecules in the management of diabetes. Thank you.